Hi, my name is Tori Furlong. I am a registered nurse. I graduated in 2015 with my bachelor's degree from Bethel University, and I am currently pursuing my master's degree through Colorado Christian University. I worked at the bedside for the last 5 years, and now I work as the director of a nursing skills lab. So I've kind of had the opportunity to see a couple different sides of nursing. So today I wanted to talk to you about the nursing profession and why I think it is such a wonderful profession. So the first thing I would love for you to do is just to think about what drew you into the nursing profession, because every person's going to have a different reason that they're here. Every person's going to have a different reason they're sitting in this room starting out their nursing education. So some of you might say that you're here studying nursing because you want to learn how to help people. Some of you might have a love for medicine. Some people just want to be able to interact with people. Some people feel like this was a very obvious calling that God placed on their heart. Some people might be here because it's got better pay or competitive pay. Some people are here for the flexible hours, and there's no wrong answer. There's no wrong reason that maybe it sparked your interest into nursing, but I would really encourage you, now that you're here, how can you work on blending these things? I think that a very well-rounded nurse is going to be somebody who cares about the science, who cares about spending time with people, who feels that calling from God, who is going to just be really well-rounded in their profession. So, the first maybe draw that some of you might have had would be the science aspect of nursing. So in preparation for college, whether you were taking your gen eds, your liberal arts education, maybe even in your high school sciences, you were preparing for your science prerequisites. So that's going to include anatomy, physiology, pharmacology, microbiology, chemistry, to name a few, and I know that there's even more that you guys have had to take, but those are to lay a foundation for your nursing career. Getting an A in microbiology is not going to make you an excellent clinical nurse. Getting an A in anatomy is not going to allow you to be a change agent and a nurse leader shaping things for your patients. That is going to lay the foundation for you, but there's more than that. So when you're studying these sciences, it's very important to think about how is this going to have a long-term effect on my clinical knowledge? How is this going to assist me in my critical thinking? So when you graduate and when you start in the nursing profession, you are going to start as a novice nurse. Patricia Benner is a nursing theorist who discusses or kind of has created a model for nurses where you're going to start as a novice and you're going to eventually become an expert. And along the way, you might hit some different steps. So you novice, advanced nurse, expert. And as you gain experiences, learn clinical knowledge, you're going to progress in that. The beauty of being a novice nurse is that there's going to be an abundance of resources available for you, or there should be, in theory. That would be a good place to work, is going to be a place that's going to take care of their new nurses. So that could look like a new residency program. That could look like an experienced nurse who takes you under their wing. That could be your preceptor. It could be somebody you start with that you just like to bounce ideas off of. It could even be your manager, who's somebody that's just going to support you. And I hope that you guys do find managers that are going to be supportive of you. But the beauty of that in that model is that you get to see how an advanced nurse thinks. You get to see critical thinking. You get to see the application of that science. You say, okay, I've got this clinical knowledge, or I've got this scientific understanding, and how do I level it up? How do I apply that to my patient's care? And you can really take advantage of the advanced nurses around you and learn that. So let's think about, with a scientific perspective, you've got a patient who has been doing well all night, and then all of a sudden their oxygen saturation drops down to 86%. So clinical reasoning, a good scientific medicine-based nursing is going to go into that room, implement an intervention. You're going to place oxygen on your patient to help bring up their blood levels. So now, check, you've taken care of their medical need. But you also need to ask yourself, what about the holistic part of the patient? What else might be going on in that patient's room besides just the drop in oxygen saturation? You also can think about the opportunity to collaborate. Who else can you bring in this patient's care? So let's first talk about the holistic aspect of this patient's care. It's very important to remember that when our patients are in the hospital, they're vulnerable. It might be scary for them. They may have avoided the doctor for the last 15 years. I've had a patient who did that, and they just believed that ignorance was bliss and they didn't want to address it. So when they came into the hospital, it was a very scary place for them. You may have people who are without their family or who get confused at night. There's a number of different things that patients can be dealing with already in the hospital, even when they're doing well. So now let's think about, as a nurse, you run in there, you put some oxygen on their face, and you say, okay, you're not breathing well, but this is going to help you. And then you rush out because you've got other things to do. How do you think that patient's going to feel? They're going to feel scared, maybe lonely, confused. Maybe they don't understand. Maybe they have dementia at night and they don't process that. So what kind of things can you do as a nurse to care about their holistic needs? How can you take care of the anxious patient? How can you identify with the patient who's lonely and doesn't have their family member? It's very important to think about this because you are going to encounter this with patients, and this is how you build rapport with them. And this is where the art of nursing comes into play. So instead of rushing in and rushing out because you have 30 other tasks to do, and that will happen, there's a lot to do sometimes. But how can you pause, even as a novice nurse, how can you pause and say, okay, what does this person need as a person? And I think that that's going to be a way that you can be very impactful as a nurse, whether you're novice, advanced, or expert. That's something we all need to pause and do. I had a similar situation where a patient was not doing very well and she was confused, and I went into her room. I did a few interventions, and then she was she was having some hallucinations, and I saw a Bible on her bedside table. And so I asked her if I could pray with her. And after I did that, just her whole mood changed. There was such a shift. She was compliant with my interventions. She was willing to keep her oxygen on. And I firmly believe it's because I took the that time to see her as human, see her as God's child who was in need. And that's how you're going to be able to really build a rapport with those patients. So those are things that you can do on the individual level. So as the nurse, you can put your medical interventions into place. You can pray. You can, love on your patient. But another beautiful thing that we have the opportunity to do is to work as a team. So that's called collaborative care. So when we're collaborative, we're bringing in other team members. And I'm sure you can already think of other team members that you might be able to bring, but I've got a list here for you. And this is just a short list. There's probably more that you could include, but we've got physicians, nurse practitioners, nursing assistants, respiratory therapists, dietitians, social work, just to name a few. And these are all people that you can bring into the care team in different scenarios. So if we shift back to our patient who had this drop in their oxygen, we've addressed their immediate need. We've put oxygen on them. We've also taken care of the holistic part of the patient. We've spent time with them. We've prayed with them. We've made sure that their emotional needs are met. But let's say they're not getting better. Let's say their oxygen stays at 86%, even though we've put oxygen on. Then what do we do? This is where we would bring in another person to assist us. So we may want to notify our doctor. Maybe we want to notify the respiratory therapist and see if they want to come and do a breathing treatment, or if they have any ideas. You could ask your nursing assistant to come in and help you reposition your patient to help make sure they're sitting upright in bed so their lungs and their airway is more clear. So these are all examples of ways that you could incorporate team members, and you can either incorporate them at the bedside, have them come and lay eyes on the patient, or, maybe the doctor, he's at home and he can't come in, but he can put in orders. Maybe he's going to order an x-ray. Maybe he's going to order a new breathing treatment, and that's all going to be based on your assessment and your recommendation. So now you've blended all of those things. You've blended their immediate need with their holistic, whole being, emotional self, their spiritual needs, and you've brought in a team member. And so this is a way that you can really be an effective nurse. This is how you can safely take care of your patients. You can build rapport with your patients. It's okay to ask for help. I encourage it. I ask for help all the time, even after 5 years on my unit, because I think that that's going to provide the best outcomes for patients. The nurse is often identified as that center point that brings in other team players. It's going to kind of help be the communication aid between your different teams, because the nurse typically has the most face-to-face time assessing the patient, interacting with the patient and their family members. So because of this, it really requires leadership and good communication skills in order to ensure that you are advocating in the best way possible for your patient. Another way that you can participate in leadership is by nursing research. So this can be systemic research, this could be journals, this could be case studies, this could be scientific research, it could be unit-based research. When I was a new nurse, I participated in a nursing residency program that allowed me to do a research study that implemented a new policy. So there's all kinds of opportunities. Medicine is ever changing, and it's important that we do research to stay up to date on it. So I just wanted to kind of briefly end with some personal experience that I've had as a nurse. When I worked at the bedside, we had several homeless patients that would come into the hospital, and they would be often unappreciative, and this would really burn out my coworkers. And I think the biggest thing for me to have an attitude change in that was the song By Our Love by Christy Nockels. It just had some very impactful lyrics for me. It was, we were made for kindness. We will love with his hands, that they will know us by our love. We were made for justice. And so I often repeat these lyrics to myself when I am encountering a difficult patient or even a difficult doctor or coworker. And when I have this shift in perspective, and when I see these people as being created in God's image, my assumptions go away, and then I'm able to be a better advocate for my patients. I'm able to see their needs, their physical needs, their spiritual needs, and make implementations based on that. An experience I had with that was a patient who was homeless and needed to be on hospice. And when I was able to pull down my own barriers, I was able to work with the social work team, and we were able to look into short-term housing so that he could have hospice care and that he could receive that in his last couple months. And so I think it's just very important to be a well-rounded nurse. Make sure that you see your whole patient, be holistic in your care. I encourage you that as you finish your education out and you enter this profession, keep to your belief system, identify ways that you can be a well-rounded nurse, and make sure that you're always integrating science, research, collaborative care, and holistic care with every person that you interact with. And in doing this, this is how you can provide the best care for your patients and be the best nurse for your patients.